Adrenal disorders, slide 24. Adrenal cortex hormones, glucocorticoids, cortisol, or mineral corticoids, aldosterone, sex hormones, androgens, and estrogens. What are the functions of cortisol? Here we have the hypothalamus, corticotropin releasing hormone, CRH, goes to the corticotropin ACTH from the hypothalamus to the anterior pituitary, then to the adrenal gland where you have angiotensin and aldosterone, cortisol, then it goes to the liver, cortisol comes back up to the hypothalamus. This is the negative feedback loop with the angiotensin and aldosterone part of the adrenal gland. You have androgens that go to the liver, that goes to the kidneys. So from the liver to the kidneys, you have hydroxysteroids, free cortisol, and the keto steroids. Cortisol affects glucose. Just remember, stimulated by the CRH, corticotropin releasing hormone, is stimulated by decreased plasma cortisol levels, hypoglycemia, pyrogen, and stress. That will decrease plasma cortisol level, and then suppressed by CRH is suppressed by increased plasma glucocorticoid levels. Actually, hypoglycemia, pyrogen, and stress will increase cortisol. But if you have decreased cortisol in your blood, you will also be stimulated the CRH, corticotropin releasing hormone, to stimulate corticotropin from the anterior pituitary to tell the kidney to release the cortisol into the blood. And cortisol affects glucose, protein, and fat metabolism, as well as the body's response to stress and the body's immune function. What are the functions of aldosterone? Aldosterone is a mineral corticoid. Aldosterone increases sodium absorption and causes potassium excretion in the kidney. What is adrenal gland insufficiency, aka Addisons disease? Often occurs in response to a stressful event, decrease in cortisol and or aldosterone. Decrease in production of adrenocorticoid steroids, cortisol and or mineral corticoid steroids, aldosterone. Signs and symptoms can occur gradually or appear without warning. Result in poor glucose regulation. So this is all adrenal gland insufficiency. We're going into Addison's disease. Signs and symptoms can occur gradually or appear without warning, result in poor glucose regulation. Patient has hypoglycemia, decreased glomerular filtration, and gastric acid production of cortisol, which leads to reduced nitrogen excretion, which causes anorexia, this lack of appetite, and weight loss. Decrease in aldosterone levels is increased sodium and water excretion, thus hyponatremia and hypovolemia are symptoms of the Addisons. And the patient holds on to potassium, which results in hyperkalemia. This hyperkalemia can result in acidosis. Addison's disease, we have the picture lady here. You also get this bronze pigmentation of skin, hyperpigmentation, changes in distribution of body hair, hypoglycemia, postural hypotension, the like orthostatic blood pressure changes, GI disturbances, weakness, weight loss. Adrenal crisis is profound fatigue, dehydration, vascular collapse, which is decreased blood pressure, renal shutdown, which is decreased serum sodium, and potassium is increased. What are the causes of adrenal insufficiency? Which is also aka Addison's disease, adrenal gland insufficiency, also called Addison's disease. adrenal insufficiency. Primary causes are autoimmune, TB, metastatic cancers, fungal lesions, AIDS, hemorrhage, gram-negative sepsis, adrenalectomy. So that's removal of the adrenal gland. Abdominal radiation, and drugs. These are all primary. Now, secondary causes are sudden cessation of long-term glucocorticoid therapy, pituitary tumors, postpartum pituitary necrosis, hypophysectomy, high-dose pituitary radiation, high-dose brain radiation. Most often see adrenal insufficiency in sudden cessation of steroid therapy. Glucocorticoid therapy is secondary cause. Negative feedback causes atrophy of the adrenal cortex. For this reason, glucocorticoid drugs must be withdrawn gradually for ACH to be adrenal to activate to reproduce cortisol again. Slide 29. Assessment finding for a client with adrenal insufficiency. Think lack of glucose, because lack of cortisol is less glucose activation. You're going to have, with this Addisons, adrenal insufficiency, fatigue, anorexia, nausea, vomiting, diarrhea, abdominal pain, weight loss, muscle weakness. So the GI is the nausea, vomiting, diarrhea, abdominal pain. Dehydration, anxiety and depression, decreased tolerance to cold, decreased body hair, hypovolemia, and hypotension, so low fluids. Remember, with Cushing's, you're like full of fluids, cushions. Significant symptoms of Addison's are usually not noticed until about 90% of the adrenal cortex has been destroyed. With lack of aldosterone, we will see signs and symptoms of dehydration, hypovolemia, high blood pressure, tachycardia, weight loss. So we have discussed some of the electrolyte imbalances. What testing is done for Addison's disease? You're going to test serum electrolytes. You're going to have hypoglycemia, hyponatremia, low glucose, low sodium, high potassium, hyperkalemia, can lead to cardiac arrest. EKG or ECG needs to be obtained. You're also going to have hypercalcemia, high calcium with this high potassium, increased BUN and creatinine. So from the dehydration, you would have the increased BUN. CBC will show increased white blood cell count. Blood salivary cortisol is going to show decreased. ECG, you're going to do X-ray, CT, MRI. Could possibly be tests to be done. CT of abdomen will check the size of adrenal glands and look for the other abnormalities and look for insight to this adrenal insufficiency. MRI scan of pituitary gland done to check for secondary adrenal insufficiency. Regarding the assessment findings, important to note that patients with Addison's disease have increased skin pigmentation, especially seen in the palmar skin, creases, and gums. Medications that should be prescribed for Addison's. We also have this picture here, slide 32, with the mouth, the nails, the palmar hands. Note the generalized skin pigmentation in a Caucasian patient, but especially the deposition in the palmar skin, creases, nails, and gums. She was treated many years ago for pulmonary TB. What are the other causes of this condition? And the medications that should be administered for a client with adrenal insufficiency, you're going to have hydrocortisone, so steroid like prednisone, cortisone, hydrocortisone. These are steroids. Prednisone, remember, taken with food. Prednisone, most common divided doses is 2/3 in the AM and then 1/3 at 1800, 6 p.m. to mimic normal release of the adrenal hormone, the cortisol. So you're like replacing the steroid with Addison's because you don't have enough. Monitor weight, blood pressure, and electrolytes. Increase dosage during periods of stress or illness. Taper ED dose or tapered dose if discontinuing to avoid acute adrenal insufficiency. Administer with food because the steroids can cause GI upset. If deficit of aldosterone, then you're going to have medications such as fludrocortisone acetate. It's also called Florinef. It's a mineral corticoid. If aldosterone's affected, mild peripheral edema is expected. Report this like weight gain. Monitor and treat the hyperkalemia. So you would use to bring down potassium. This high potassium, you can use insulin, glucose. You have to give with that. IV K-oxalate can help to decrease potassium. Monitor and treat hypoglycemia, this low blood sugar, so you have to give glucose. You know this medication is working if patient has decrease in fatigue, anorexia, where if you correct these symptoms, potassium normalizes. If you decrease in weight and body fluid, and sodium levels increase. So sodium levels will increase because you were hyponatremic. With adrenal insufficiency, the patient can develop hyperkalemia and ultimately cardiac arrest if corrected, or if not corrected. So you need to correct this hyperkalemia. Monitor ECG, cardiac monitor. Insulin drip requires ICU. Add glucose infusion with it to prevent hypoglycemia. Hyperkalemia can causes cardiac arrest, so it's very important to monitor. Hypoglycemia with adrenal insufficiency, do frequent glucose checks. So what should be included in the plan of care for a client with adrenal insufficiency? You're going to want to promote fluid balance and monitor for fluid deficit and electrolyte imbalances. IV normal saline to restore fluid balance. Monitor electrolyte imbalances. Administer most commonly normal saline IV to restore balance. Record weight daily. Check vital signs, orthostatic vital signs obtained. What is acute adrenal insufficiency, aka Addisonian crisis? This would be an acute drop in adrenocorticoids due to a sudden discontinuation of glucocorticoid medications or when induced by severe trauma, infection, or stress, such as prednisone, or induced by a trauma, can be life-threatening. Nursing interventions are monitor vital signs, IV access and rapid infusion of normal saline, IV push, hydrocortisone, followed by continuous infusion. Also for this Addisonian crisis, which is also called Addisonian crisis or acute adrenal insufficiency, steroid hydrocortisone IV push, calcium to counteract the effects of hyperkalemia and protect the heart. I guess the calcium will help keep it from this possibility of cardiac arrest. Can lead to hyperkalemia, which can be life-threatening. Administer calcium chloride or calcium gluconate, which is a stabilizer to protect the heart. Hyperkalemia, K-oxalate, loop, or thiazide diuretics can help to decrease this high potassium to get rid of excess amounts of potassium. Low blood sugar, hypoglycemia, you can give glucose or glucagon can be administered. Additionally important, H2 blockers for stress ulcer prevention. And then vasopressors, PRN, such as norepinephrine, levofed would be a vasopressor to help increase the blood pressure if they were having low blood pressure. You're going to monitor all these vital signs. So this ends the Addisons, and we're going to move on to Cushing's on our next video.